Welcome to the deep dive. Today, we're really getting into something fundamental, human vision. It's how we experience so much of the world, but we rarely stop to think about how it actually works.
That's right.
We'll explore how our eyes and brain pull off this amazing feat of seeing, how we measure vision, and, why understanding these details is so critical, especially in certain jobs where seeing clearly is just paramount.
Absolutely. We'll start with the basics, the biology of sight, then move into how we measure things like acuity and contrast.
Okay.
And finally, we'll look at the standardized tests and why they matter so much in the real world, particularly for safety in certain occupations. It's a journey from sort of basic light perception to workplace standards.
All right, let's kick things off then. Let's unpack the foundations. How do we actually discriminate visually?
Well, there are a few key elements.
Yeah.
First is spatial discrimination.
Okay, like reading small text.
Exactly. Or seeing details far away. You need a sharp image on the retina, and the retina needs enough grain, you could say, to resolve those tiny details.
And then there's contrast.
Yes, luminous contrast sensitivity. That's about picking out differences in light intensity. Think about finding a white object on a light gray background.
Tricky.
It can be. Optical issues in the eye might limit this for tiny things,
Yeah.
but for larger objects, it's more about how your neural pathways process the information.
And of course, color. That seems pretty fundamental.
It is. Color recognition depends on having the right photopigments in your retinal cells, the cones and rods, and then faithfully transmitting those signals up to the brain. It's quite a sophisticated system.
It sounds incredibly complex. How does the brain even handle all that incoming information?
Well, it's fascinating, actually. It seems to be a two-step process. First, there's this automatic, pre-attentive scan of your entire visual field.
So like taking it all in at once.
Kind of, yeah.
Yeah.
Your brain processes lines, edges, colors, movement almost instantly before you even consciously focus. Then step two is localizing, focusing your attention on specific objects. Some researchers even think that initial rapid comparison, the brain checking new visual input against memory, might be linked to that weird feeling of déjà vu.
Déjà vu. Really? Like a slight processing delay.
Possibly a momentary mismatch in that comparison system. It highlights how specialized our visual processing is. We have different brain sensors just for lines or edges or movement direction or color.
And these systems can sort of linger. You mentioned persistence.
Yes, exactly.
Yeah.
Like staring at a bright light, then looking away and seeing the after image.
Oh, yeah, definitely.
Or the waterfall illusion, stare at the moving water, then look at the rocks, and the rocks seem to flow upwards. That's visual persistence. Our brain holds onto the signal for a moment.
That makes sense. And that persistence probably affects how we tell things apart.
It does. It's harder to spot the boundary between, say, L's and T's if they're mixed together because the lines are similar.
Yeah.
But if you have upright T's and tilted T's, the difference just pops out.
Because the orientation is a clear difference.
Right. Similar features get grouped, making differentiation harder. Big differences make things stand out.
Like with color. A bright red object in a green field is easy to spot.
Absolutely. Geometric similarity can sometimes overpower color differences if they're subtle. But a major color difference makes an object incredibly obvious, even in a really crowded scene.
So spotting that one different thing can be fast, regardless of how much other stuff is around.
If the difference is big enough, yes. Detecting it among 30 items can be as easy as among 3, but searching gets harder when things are similar.
Okay.
In that pre-attentive stage, things sharing properties like length or orientation just don't stand out. If the target's very different, you don't need much prior info. If it's similar, you need more specific detail.
And it takes longer to find it if there are more similar items.
Exactly. The search time increases linearly with the number of similar distractors. And interestingly, it's easier to find the presence of a feature than its absence.
What do you mean? Like finding a Q among O's versus an O among Q's?
Precisely. Finding the Q among O's is easier because the Q has an added feature, the tail. Finding the O among Q's means looking for the absence of the tail, which is harder. Our visual system seems geared towards spotting something added.
That's really interesting. Our brains like addition more than subtraction, visually speaking.
You could put it that way. And this ties into Weber's law, a basic principle stating our ability to notice a difference in intensity is better when the overall intensity is lower.
So you spot a faint light more easily in a dim room than a bright one.
Exactly. Our sensitivity to subtle changes actually goes up in lower light.
And that's used in things like fluorescent testing.
Right. Fluorescent materials absorb invisible UV light and re-emit it as visible light. It makes tiny flaws like cracks glow brightly.
Making an invisible signal visible.
Ish.
Clever.
Very. It amplifies the signal. Of course, you need proper safety with UV light sources.
Okay, so that's the processing side. What about the eye itself? The actual hardware? You mentioned the camera analogy.
It's a good one. The cornea, the clear front part, and the crystalline lens behind it are like the camera lens. They do the focusing.
The cornea does most of the work.
Yep, about 43 diopters of power. The lens adds maybe 19 more, and crucially, it can change shape, accommodate to focus at different distances, at least when we're young.
The dreaded reading glasses stage.
That's presbyopia. The lens loses elasticity with age, usually noticeable around 45. Focusing power just naturally declines.
Okay, so cornea and lens for focus. What about the aperture?
That's the iris, the colored part. It controls the pupil size, regulating light entry, just like a camera's aperture diaphragm. It's pigmented to block stray light.
And the film.
That's the retina, a thin layer of neural tissue at the back of the eye where the image is captured. But it's not uniform. The sharpest vision is right in the center, in the fovea centralis.
Which is why our eyes are always moving, to aim that spot.
Exactly. 6 muscles per eye constantly work to keep the target on the fovea. Within the retina are the rods and cones.
Rods for night vision, cones for color and detail.
You got it. Cones are packed in the fovea for sharp, central color vision and bright light. Rods are more in the periphery for peripheral and low-light vision.
And the signal goes to the brain via the optic nerve.
Correct. Though interestingly, light has to pass through other retinal layers before hitting the rods and cones, except right at the fovea, where those layers are pushed aside for clearer access.
Amazing design. But sometimes the focus is off, right? That's where glasses come in.
Exactly. Refractive errors. If the eye focuses light in front of the retina, that's myopia or nearsightedness. Distant things are blurry.
And if it focuses behind?
That's hyperopia, farsightedness. Near vision is blurry. And then there's astigmatism, where the cornea isn't perfectly round, blurring vision at potentially all distances.
All correctable with lenses, thankfully.
Most commonly, yes.
Okay, so we have the biology. Now, how do we actually measure vision? Put numbers on it. This is where it gets really interesting.
Right. We talk about vision acuity. That's basically your ability to resolve fine detail.
Like reading the eye chart.
Exactly. It's measured by finding the smallest high-contrast letter you can correctly identify. A normal eye should resolve detail that subtends 5 minutes of arc or less.
Minutes of ARP. Explain that.
It's about visual angle, how large an object appears in your field of view. Something closer takes up a bigger angle. Think of the sun and moon. Huge difference in actual size, but they appear about the same size to us, both subtending about half a degree of visual angle.
Okay, got it. So the letters on the chart are designed based on this angle.
Yes, the standard Snellen letters fit in a 5x5 grid, and the critical detail, like the gap in a C or E, is 1 unit or 1 minute of arc for the 20/20 line.
So 20/20 means you can see that 1 minute of arc detail.
Correct. In the Snellen fraction, like 20/20 or 20/40.
20 is the testing distance, usually 20 feet.
Right. And the second number, the denominator, is the distance at which someone with normal 20/20 vision sees that same detail.
So 20/40 means I see at 20 feet what a normal eye sees at 40 feet. My vision isn't as sharp.
Precisely. It's a straightforward comparison.
Now, what usually causes reduced acuity, besides needing glasses?
Uncorrected refractive error is the most common reason by far. That's why testing with the right glasses for the task and distance is crucial. If your far and near vision differ a lot, even with correction, you might need an updated prescription. Other causes could be things like cataracts clouding the lens, or retinal problems like scarring from diabetes.
Right. But standard acuity tests don't tell the whole story. That's where contrast sensitivity comes in.
Because real life isn't always black letters on a white background.
Exactly. Spotting something faint, like a shadow on an X-ray, depends heavily on contrast sensitivity. Our visual system is actually best at seeing medium-sized patterns, not extremely fine or very broad ones.
Are there specific tests for contrast?
Yes. Tests like the Pelley-Robson use letters that stay the same size but get progressively fainter, lower contrast.
Right.
The Mars test is similar, but handheld for reading distance. They give a better sense of functional vision for many real-world tasks. Makes sense. What about measuring color vision? We know some people are colorblind.
Right. Our color vision relies on those 3 types of cones. S, M, and L, wavelength sensitive, roughly blue, green, and red.
And deficiencies happen when one is missing or faulty?
Correct. About 2% of males are dichromats, missing 1 cone type. They have significant trouble distinguishing certain colors, like browns, greens, or purples, blues.
And it's mostly males.
Red-green defects are sex-linked, so yes, much more common in males. Then you have anomalous trichromats, about 6% of males. They have all three cone types, but one isn't quite right. Their color vision can range from nearly normal to severely affected.
Blue-yellow defects are rarer.
Much rarer, and they affect men and women equally. It's also important to know if a deficiency is inherited or acquired.
How do they differ?
Inherited ones are usually stable, same in both eyes, no other vision loss. Acquired ones, maybe from eye disease, can change, differ between eyes, often affect blue-yellow first, and might come with other vision problems.
And age affects color vision, too.
Yes. The lens yellows over time, filtering out some blue light, which subtly shifts color perception, especially for blues and violets.
Okay, so this detailed understanding of vision and how to measure it. What does it mean practically, especially for jobs?
It means regular vision testing is crucial. General recommendation is every 2 years for adults. But for visual inspectors in critical roles, maybe every 6 to 12 months.
Because catching a tiny flaw could be life or death in some cases.
Precisely. And the testing method has to be rigorous. You don't want someone with inadequate vision passing a screening.
And testing standards have improved. You mentioned changes after 1994.
Big changes. The push was towards logMAE charts. They're more uniform proportional spacing, same number of letters per row, usually 5, and the size changes logarithmically, about 20% smaller each row.
More scientifically designed?
Yes, and usable at various distances. The scoring also changed. No more just getting 70% right on a line.
What's the method now?
Letter-by-letter scoring. You read everything, guess if unsure. You basically need the equivalent of getting 100% on a line to score that acuity level. Correct letters on smaller lines can even balance out mistakes on larger ones. It's much more accurate and reliable.
Lighting matters too, right?
Absolutely. Standardized, bright illumination is key. Acuity improves with brightness, especially for older people. Needs to be consistent, ideally mimicking daylight. Professional test units control this.
Does a doctor always have to do the test?
Not necessarily for acuity, if the administrator is well-trained and follows the procedure exactly. Key is testing each eye separately first, then both together to prevent memorizing the chart.
And using different charts for retests helps with that too.
Definitely.
What about near versus far vision testing, particularly for older workers?
Young people, properly corrected, should have similar far and near acuity. But over 45, presbyopia kicks in. Reading glasses or bifocals become necessary.
And the prescription has to match the actual working distance.
Critically important. Bifocals set for reading a book at 400 millimeter might blur instruments at 660 millimeter or 800 millimeter. Pilots, for example, often need correction checked at far, near, and intermediate distances.
So near vision tests, how are they done?
Usually tested at about 400 millimeters or 16 inches. Distance accuracy is vital. The Jaeger chart, J1, J2 text sizes, is common, but its Snellen equivalent can be inconsistent.
Better option.
Reduced Snellen charts designed for near are often preferred. They look like the distance charts, just smaller, calibrated for 400 millimeters. Some have multiple letter sets to foil memorization.
Okay, switching gears slightly to color vision testing. What's the goal there?
It depends. Some tests screen for normal versus deficient. Others measure fine discrimination ability. The key principle is using a test that mimics the actual job task as closely as possible.
And conditions need to be standardized.
Absolutely. Standard daylight simulating light, Illuminate C, is ideal for consistent color rendering. Regular room lighting is usually unsuitable. And procedures, like viewing time for certain tests, must be followed strictly.
What are some common color tests?
Pseudo-isochromatic plates, like the Ishihara test, are very common for screening red-green deficiencies. Quick and easy, but maybe not the best predictor of on-the-job performance.
What about finer discrimination?
For that, you have arrangement tests. The Farnsworth D15 uses 16 colored discs the person arranges in order. It's designed to catch moderate to severe defects, both red, green, and blue-yellow, that might impact job performance. It's relatively quick.
And there's a harder version.
Yes, the Lanthony desaturated D15 uses paler colors. It's much more difficult, good for detecting subtle acquired defects or assessing very fine color discrimination.
So tying it all together, good vision is non-negotiable in many jobs.
Especially safety-critical ones, like aerospace inspection. Regular testing ensures people remain fit for duty. What's surprising is that while testing has existed for decades, the standards haven't always been empirically tied to specific job tasks.
So how do you determine the minimum acceptable vision for a job?
That's the million-dollar question. And honestly, it's incredibly complex. Setting one absolute acuity limit is basically impossible because so many factors are involved.
Like the size of the flaw, the lighting, the viewing distance.
Exactly. Contrast, accessibility. It all matters. Researchers use things like probability of detection or POD curves to model this. NASA and Boeing have done studies looking at detection rates for specific flaw sizes under certain conditions.
So how can detection be improved?
You need to boost the relative signal strength, make the flaw easier to see.
How? Closer viewing, better glasses, more light.
All of the above.
I-
Decrease distance, ensure the image is perfectly focused on the retina with the right correction for that distance. Improve lighting quality and quantity, cut glare.
Makes sense.
And crucially, because people get fatigued during long searches, that vigilance decrement we talked about, it's wise to require vision better than the absolute calculated minimum. You need a buffer.
That fatigue factor is huge.
It really is. One study modeling aircraft crack detection showed POD dropping sharply, even with seemingly small reductions in acuity, like going from near-perfect detection down significantly with just 20/25 vision, especially for harder-to-see cracks.
Wow. That really underlines the need for sharp, properly corrected vision at the specific working distance.
Absolutely. Maximum correction is key. Even small things, like the angle of illumination creating tiny shadows, can make a big difference in spotting surface flaws.
This has been incredibly insightful. It really drives home that seeing is so much more than just having 20/20 vision on a chart.
It truly is. It's this intricate dance between the physics of light, the biology of our eyes, sophisticated neural processing, and even psychological factors like attention and fatigue.
It involves understanding the eye's mechanics, how we measure its different capabilities like acuity and contrast and color, and then applying that knowledge through rigorous testing, especially where safety is on the line.
Precisely. And it leads to a fascinating final thought for you, the listener. How much of your own perception of the world, maybe noticing a tiny detail at work, maybe appreciating the nuances in a painting, or even just navigating your daily life, is shaped not just by the raw data your eyes gather, but by all that complex, often unconscious processing happening inside your brain? And thinking about that, how might you actively optimize that amazing visual system for better performance, safety, or even just richer appreciation in your own experience?